and have a seat over here. Okay, lay on your back, head over there by the pillow, please. Make yourself comfortable. Is pillow okay?
Yes.
All right, then. So, I forgot to lock it. Okay, so patient got on the table. First thing we do, raise the table up to our height, make it comfortable. Next, what do we do?
Lock the table.
We do not lock the table.
Oh, you don't lock the table after you
Do not lock the table. You only lock the table when the patient gets on and off. You're already on the table,
Oh,
I
okay.
do not need it locked.
Oh.
So what am I gonna do here?
Move it to 40 SID.
Okay, great, so we need to get our tube lined up to our buggy, right? Just like how you set up your chests, you need to set up here to the buggy as well. Okay, so first things first, I need to tell the machine I'm aiming at the table buggy.
Do you have to switch it?
Good, so I'm gonna switch it over. Now, this row, remember the table buggy has this slot here. So we actually need to take our cassette and put it into this slot. So I'm just gonna take my cassette and put it in lengthwise. Okay, cassette's nice and snug inside. Push it back in. Let's finish lining up our tube. First thing to do, we're gonna lock it, transverse. Okay, Tori mentioned SID, so I'm gonna take this SID, drop it down to 40. Okay, final thing. Do I need to lock it along the green?
Yes.
I do not.
Oh.
go. Oh.
So I am not gonna lock it along the green.
Okay,
Instead,
you still need to go up.
I am gonna aim this at something else.
You're gonna do it Cephalic?
What am I aiming it at?
Oh, the actors.
What is this thing
Oh,
down
the
here?
as is?
The bucky down
The
here.
bucky. Okay, line it up with the
Right,
bucky.
so, I don't care about locking it in place. All I care about is getting this aligned with my bucky. As long as these are lined up, I'm good to go, right? Now, sometimes it'll lock you, right? You're gonna stop at the lock, that's fine, you can do that. But if you wanna be not at a lock, also, no issues.
Okay.
Right? This bucky can slide up and down. You just need the tube to match the bucky. Alright. Once you get this set up, alright, this is the most important part, so please remember this. In fact, I'm gonna have you repeat after me. Once you get the tube and the bucky lined up, do not touch the tube.
Oh.
So when you get the tube and bucky lined up, what should you not do?
Touch the tube.
Alright, I did that. Oh, alright, that was
You
not
should
good
not.
because that sounds like you want to touch the tube.
Yeah.
So, okay. What do you line up?
You line up the bucky and the tube.
Good. And once these are lined up,
You do
not
not touch the tube.
good. There we go. Much better.
Okay.
Alright, one more time. What do you line up?
The bucky and the tube.
Do they have to be locked to each other?
No.
They have to be locked to each other.
So they have to be lined up.
Lined
Lined
yeah.
up, yeah. They
But
have to
it doesn't have to be locked.
Good.
Yeah.
And once you get it lined up,
You
then
don't touch the
Don't
tube.
lock it. Yeah, don't touch it.
do not touch it. So,
So you have to move your patient?
correct.
Okay.
So I need to move my patient, right? Because I want these to stay lined up to each other. So am I just gonna have my patient slide back and forth on the table?
No.
No. So this is why we didn't lock the table, because we are gonna float
the table.
our patient all around. And as you notice, the table floats independently of the tube and bucky. So they stay lined up while the patient is moving around here. So that is why we do not need to worry about locking the table
Okay.
once we raise it up. Just line these up
Okay.
and you move the table around. Now, before you start trying to center, because everyone lines it up and then tries to center, there's one more important step you need to do. So please stand at the head of the table. I'm going to come here. So stand at either the head or the foot of the table. Look straight down your patient and check to see your patient is straight. Okay, make sure your patient does not look crooked. Make sure the hips and shoulders, right, are in a nice line. The shoulders aren't off to one side, the hips aren't off to a different side. Make sure they're nice and lined up. So what do you think?
I think he's nice and lined up.
Okay, and then Tony, what do you think?
I think he a little bit.
Well, I don't think he's centered, but I think that he's not rotated. Like, I think that he's straight.
He's
Right.
straight. He's straight. Yeah.
You think he's straight? All right. I actually think that
But
his
this
hips
is more even.
are slightly more to the right, and I think his shoulders are slightly more to the left. And so I think that his hips are like,
Okay.
yep, and his shoulders like that. I don't think he's coming straight down the table, right?
Okay.
If he's straight, I'm going to touch him here. Right. So this is what I consider to be my straight,
Okay, that's all.
right? So I think he's just very slightly off.
Okay.
So
Float the
I would
table.
ask him to just take your hips and slide them a little bit to your left. Good. Okay. Now come back over and
The
see if that
shoulder.
did the trick.
Yeah.
So it looks perfect now. I don't need to move the shoulders.
No shoulder moving.
So
Okay.
move one or the other.
Okay.
If it's a really big thing, then maybe you need to move both.
Okay.
In this case, I think moving the hips was good enough. So now that our patient is straight, we're able to start positioning. Okay. Very simple mistake to make, because if you start positioning first and then later realize the patient's not straight and then you try to fix that, you've just wasted all your time. Right now, is the tube pointing sideways or up and down?
Up and down.
Up and down. So where do we center?
MSP.
MSP?
Yeah,
And
MSP.
do we center at the crest or 2 inches above?
At the crest.
At the crest. Remember, anytime the tube is up and down, you center at the crest. Anytime the tube is sideways, you center 2 inches above.
So when we were doing the erect, I know that I walked in late, but you centered 2 inches above. So wait, that's a crosswise?
So it doesn't, nothing about lengthwise, crosswise.
Oh, okay.
It's just, is the beam horizontal or is the beam vertical?
Oh, okay. Okay.
Tube is pointing sideways, you go 2 inches
Above.
above. Tube swinging up and down,
You
go
stay
to
at
the
the
crest.
yeah, crest. Okay, thank you.
All right, let's see here, fix my collimation. Okay, and once again, we're gonna check for that iliac crest. So pardon me, I'm gonna check for your hip bones.
Okay.
By the way, say hip bones, don't say iliac crest. Patients don't know what iliac crest is. There it is, nice iliac crest. All right, good, all the way to the side here. Okay, so I found my iliac crest. Now I need to get my MSP. When you go for your MSP, you're floating the table still. Remember, the table floats in all directions. If you just immediately try and go for MSP, you're gonna lose your iliac crest because it's gonna slide up and down as well. So what do? Take your finger and mark the location of your iliac crest. This here is the height of my iliac crest. I know so because I centered here and my line is here. So now, even if I slip up, I can always bring this back to the height of my iliac crest. Saves yourself time, you don't need to dig in the patient a second time. And now all I need to do is worry about MSP. So I'm gonna try and find my MSP. If I accidentally go whoops, fine, just come back and keep looking for my MSP. All right, I'm gonna pat down the patient's clothes because clothes are baggy, they can throw off your sense of centering. So always pat down the sides of your patient's clothes, get a good idea of the patient's actual shape. I think then you'll come just a little bit further in. Okay. So I think that this is pretty much my MSP, right? Straight up and down like this.
Yeah.
So stand at the head and the foot, right? Double check yourself. One other way you can do it is you look at the side of the patient. There's either going to be light or there's going to be shadow on the side of your patient. Whichever one you have, make sure it looks even on both sides. If I have shadow here, I want the same amount of shadow here. If I have light here, I want the same amount of light over here. Okay. We've got our centering. Next, we need to do our positioning. Anything else that we can do to improve our position? Well, arms are to the side, they're away from the body. That's already perfect. Something we can do to help make this look even better is to straighten out the back. Right now the back's kind of arched because it has that natural curvature. We can help reduce this by telling the patient to bend their knees and put the feet flat on the table. And that can also relieve pressure on the back, makes it a bit more comfortable. Okay, if you've got a spare pillow, put it under the knees, give them some support as well. Just like on our,
DQ.
yeah, like on our DQs. Good. All right, final thing, marker collimation breathing. So which marker am I gonna use?
You can use either,
Yeah, it doesn't
matter.
yeah, either or.
Okay, which marker do you want me to use?
Left.
Left,
Right.
okay, right. Okay, I mean, I guess I could use both.
Yeah.
In this case, I'm gonna use right, just because right side is closer to me.
Okay.
I'm lazy. Okay, don't wanna have to reach an extra 6 inches. So, question, do I put marker up here, in the middle, or down here? Which corner do I put my marker in?
All right, yeah.
Upper corner?
Yeah. But specifically, like when we're looking at like a supine, what are we looking for?
So, is this an upper abdomen or a lower abdomen
I
x-ray?
think it's a lower.
This is a lower abdomen x-ray. Good. So, we're gonna have liver and stomach up top, kidneys near the middle, bladder and pubic symphysis at the very bottom. So, liver and stomach, part of the abdomen. I don't want my marker inside them. Kidneys, part of the abdomen. I don't want my markers inside them. Okay, bladder is in the center. Pubic symphysis is in the center. What's to the side of the pubic symphysis?
The iliac crest, so the greater trochanters, nothing.
So the hip.
Of the hip, yeah.
The hip, right? So including greater trochanters. Is the hip part of the abdomen?
Yeah.
It is not. So I am putting my marker in the hip. Okay, that's my logic behind putting the marker down here. That way I don't have my marker inside anatomy. Does that make sense?
Yes.
Okay, now, putting my marker like this looks kind of awkward. So, can we do anything else with our marker?
Then
You
it
said you
beneath
put
it.
it under.
Yes, we can have our patient just roll over a
To the
tiny
side.
bit, sneak it under their butt, have them roll back. Or, you could even pull out the bubbly tray, put your marker on the cassette and slide it back in.
Okay.
However, be very careful which equipment you do that with. Not all equipment has the same amount of space underneath to let you slide the cassette in. The older equipment has more space. You can safely put your marker in and out. This equipment does not give you a lot of space. I tried it on Tuesday. I almost lost my marker. I put it in, I put it out, my marker was missing. I had to go digging in under there to pull my marker back out. So, at least in this room, don't put your marker on the cassette.
Okay.
Just slide it under the patient. Perfectly fine. So, now that we've got our marker in place, final step is going to be breathing. So, same instructions as before. Take a deep breath in, blow it all the way out, hold it out. Don't move, don't breathe. X-ray, you can breathe, you can relax. Very good. And
So
that
it's
is our
expiration.
supine.
Oh, okay.
Expiration.
It was expiration? I thought he was holding his breath.
You do hold the breath, but hold the breath at the very end after they breathe out.
Okay.
So deep breath in, blow it all the way out, blow it all the way out, hold it out, don't move, don't breathe. X-ray, breathe and relax.
Okay.
Those are the instructions I find to work the best. Okay, so once we're done, we can get our patient off the table. Now, if we just tell our patient you're done, patients will sit up, bam. It's a 2, right? So, we don't want that. Let's try lowering the table first, see what happens. Okay, you notice that I am checking under the table, make sure there's nothing there. All right, now if Thaddeus sits up, what's gonna happen?
You gonna hit it?
It's still
Bam, he still hits it. So, you do need to move the tube out of the way. There are two directions in which you can move this tube. You can move it this way or that way, or you can move it this way, right? You can use the green or the blue. My recommendation is to use the blue.
Just push it towards
Push
the
it
wall.
To the side.
towards the wall. Why? Because when you want to bring it back, you just bring it back until it locks. You are still centered to the bucky. If your next patient is also on the table,
Slide.
get them on, slide it over. You're already centered with your tube and the cassette. All you have to do is float the bed. You slide it all the way out here.
Start over.
There's no lock, right? You have to slide it back, use the laser, line things up. Too much trouble. All right. Need help sitting up?
Well, yeah, it'll be a lot of weekend.
Very good.
All right.
You wash your head. There you go. All right, great job. So always do offer to help the patient sit back up as well. Okay, great. So those are our two mandatories, erect and supine. What time is it? I know I tend to
71.
Or-
What? 7:51.
51, okay. I know I tend to ramble a bit, so might need to speed things up slightly. Okay, who is our next patient?
I'll be the next patient. Or do you want to be the next patient?
Yeah. I can-
Okay, you can go.
Okay. Whoever's the last patient gets to do the 2D cubes.
Oh, that's fine. I'll do this.
Hi, Esther.
Okay, have a seat, please. Okay, on your back, head over by the pillow, please. So personally, I prefer to start all my patients on their back, regardless of what I actually plan to do. But if you want to start your patient prone or lateral just because you know that's what you're doing, that's fine, that's up to you. I just feel like it's more comfortable for the patient to start this way and then go to the correct position for the minimum amount of time. Speaking of which, if you could now, turn onto your stomach, face down. And turn the other way. Yep. So turn around, good, good, good. It's okay, I'm here. Keep going, all the way, all the way. There you go. Great, great. And see, notice, right? Not only do I tell the patient what to do, right? You use hand motions, you use everything at your disposal to help your patient get in position. Lined up.
Yeah.
Perfect. Right, 40 inch SID, lined up, locked in place. So, now that our tube and bucky are lined up, what do we do?
You make sure that he's not like that. You make sure that he's straight.
Great. So, let's go to the head and foot of the
I
bed.
like the foot.
Let's check to see if he's straight.
The head, I can't see.
You're like
No.
too far to the left.
Yeah.
Okay, what is too far in which direction?
He's too far to the left. You need to slide more to the right.
What part of him needs to slide more to the right? His shoulders, his hips, everything?
That's just his legs,
Yeah, his hips.
his hips.
Great. So,
It's easier to look over here.
Oh,
If you
okay.
come right here, you know exactly. Up there, I really couldn't see it.
I can see because his heels, I saw
Yeah.
it was slanted. So
But
I'm
you
like,
can
okay.
see like his one hip's.
Oh yeah, that's
Yeah,
broke
see.
out. Yeah.
all right, so stay over here then. Okay, Tom, slide your hip over towards the left, please. Away from me. Away from me. All right, stop. What do you think now? Is that better? Did he go too far? A little bit more?
We just need to go back this more this way. Maybe because his legs is dangling more at an angle this
All
way.
right, so let's fix his legs, get them nice and straight.
That looks better right there.
All right, so you think he looks straight now?
I mean, his body's straight, but he's not straight. We're not talking about on the table, right?
Right.
Okay, then yeah, because he's a little crooked on the
Mhm.
table.
So I think that his hips actually went a bit too far to the
Okay.
left. I think he can come back towards us just a bit. All right, so come back towards the right, please. Come towards me. There you go. Hips only. Yep. One more time. Hips only. There you go. Good.
That's good.
All right, so a trick I like to use, take your pinky finger and put it straight up and down. Right, so is it straight up and down? It's not crooked?
I don't
Yeah.
think it's crooked.
Okay, so what I do from here is I take the bottom part of my pinky, right, and I line it up to something I know is midline on him. So in this case, right, I'll line it up right here. So pinky straight up and down, bottom part is right here.
Okay.
And then I look up, and then I check to see if something else that I know is midline, like this, is at the top of my pinky. Right? If everything is properly lined up, this
Okay.
should follow all the way up to the pinky.
Okay.
Does that make sense?
Uh-huh.
So if you see me doing this, that is exactly what I'm doing. I'm just saying like, all right, I see that this part between his legs are right here at the bottom of my pinky, and the middle of his neck is at the top of my
At the
pinky.
top.
So everything is lined up.
Okay.
Great. What position is this?
It's prone.
Prone, good job. What projection is this?
PA.
PA, very good. Let's go ahead and do our centering. Tube is vertical or horizontal?
It's vertical.
Vertical, so that means we centered at iliac crest or
P.
2 inches above.
Iliac
Yeah,
crest.
Iliac crest, good. Okay, I'm gonna check for your hip bone, okay?
Okay.
All right. No as here, right?
Nope.
As is in the front.
Mhm.
So I'm just gonna go straight to the side and feel for the hip bone.
Okay.
I feel bone right here. Is that my iliac crest?
I don't think so.
Not necessarily. I need to keep checking upwards,
You
right?
go upward, yeah.
I still feel bone. Is that my iliac crest? Okay, I still feel bone. Is that my iliac crest?
Now keep going till you get to the flesh.
I still feel bone. Is that my iliac crest?
No.
I lost my bone. It's all muscle
Go
now.
down just a
So
little
that's
bit.
it.
Go
Right
back
there,
down.
okay.
There we go, right? So even if you feel bone, don't stop.
Keep going until you
Get
can't.
flesh.
Exactly. Keep going upwards until you feel flesh. So,
That
oh,
was good.
Oh,
Okay,
alright.
right on, perfect.
right on, okay.
Mhm.
Got lucky. So, use my finger to mark this position.
Make sure
Float my
it's
patient
center.
over, yep, make sure he's MSP now. So for the PA, MSP is really easy because you actually have access to the spine again. So just check the spine. Oh, look at those spinous processes. Yeah, just make sure it follows it all the way down. Okay. Pat it down nice and nicely. So here we actually do have a little bit of light on the side, so we have room to kind of squeeze our marker. Okay. Now, if we had so I'm gonna demonstrate this since, all right, so I'm gonna take this pillow away. Go ahead and just rest your chin on your hands instead. Yep. So if you have two pillows, right, leave one pillow up by the head, second pillow, bend your knees. Bend, up, there you go, back down. Goes down here by the ankles. Right, so pillow by the head, pillow by the ankles, if you have two pillows. All right, so everything was lined up. We now need to do our markers, collimation, and breathing. Earlier I said we did have a little bit of light here. Right, so if you wanted to, you can actually try and squeeze your marker in here. Now, to be honest, it's a little bit tight. I personally wouldn't risk it because I do feel like I'd end up sticking my marker in here anyway. So instead, I am going to mark once again down here by the hips. Okay, so, which side is closest to me right now?
The left.
Left, good. So I could, for example, take my marker and stick it on the back of his hips like that. Right, stick it on his butt. Or if I want to be even better and reduce that OID, just tell him, okay, move this hip just a little bit. There you go. Slide underneath. Good. Back down. Just squeeze it under the hips there. Okay. If he turns a lot, turn. You notice that, right? I did squeeze it into the light, even if you can't quite see it. Okay. We have our marker, we have our collimation. We didn't really collimate since we want the whole thing. So, final step, breathing. Okay, let's see, Tori, would you like to give us some breathing instructions?
Okay, so you're gonna breathe in for me, take a deep breath in, breathe out, and then take another deep breath for me. And then breathe out, don't breathe, X-ray, okay, you can breathe in a lot.
All right, that's perfectly fine, very good. You didn't need to do the second one, but since you
I
did,
realized when I did
No
it,
worries.
I was like,
But you
dang
did
it.
right, you kept going. Yeah,
Kept going.
get right back to it.
the patient doesn't know, so it's okay. Okay, so any questions about the PA? Relatively straightforward, just make sure you are finding the actual crest.
Mhm.
Remember,
just
if
keep
you,
going until you find.
correct. And if you ever need to double check yourself, Just remember, right, you can feel over here.
Mm-hmm.
I can feel the trochanter right here. Bottom of the leg at the trochanter. See that?
Mm-hmm.
So that's how you double check yourself. Tony has some really great trochanters right here. Very easy to find. Okay, next up, we are going to do the lateral abdomen. Remember, it's not lateral decubitus right now, it's just lateral. So I'm gonna take this pillow out. Good. And for laterals, just like chest, we're gonna, by default, do left lateral. So,
Yes.
come on, I want you to turn and face that wall, please. Face the other wall. Turn to face that way. There you go.
And we do the left because of the stomach, right? Tony, he was telling us in
Oh,
class.
okay, yeah. Sounds
Yeah,
good.
so that,
The air.
Sounds like a great reason.
Mm-hmm.
It does.
okay.
All right. So bend your knees, please. Good. Legs on top of each other. Bring them apart so we can put the pillow here. Good. Back down. Perfect. All right. Nice and straight. Good. So a patient turned lateral. What's our first step?
Is that lateral? You would still check the feet to make sure you
He's
was
got
straight.
straight his head is pushed this way.
Good. So
Mhm.
even though the body is lateral, he's turned. He is crooked. His
Yeah.
MCP is not straight. So what does he need to do?
He needs to bring his top back to about right here.
Good. So Tony, bring your left shoulder backwards, please. I specify left shoulder because if we just say shoulder, people.
You talk all back
Turn.
here.
Okay.
Straight now.
All right. What do you think? A bit better?
Yes, better.
Mm-hmm.
Yes. Can we still improve this?
Yeah.
What else do we need to move?
You need to move this part down this way.
All right. So Tony, if you could move your hips forward, please.
Just a little.
Scoot forwards. Keep going.
Mhm.
A little bit more.
That looks good right
Okay.
there. Mm-hmm.
How does that look now?
That looks good.
That looks good.
Mm-hmm.
So if I go to check now, I'll be happy.
Do you have a pinky trick with this?
Pinky trick? Same thing, just make sure the pinky looks like MCP. Yeah, I'm happy with that. Good. All right. So, if you have a spare pillow, right, put the pillow here between the legs. I'm gonna take this out. In addition,
I have a question, Mr. Fong.
Yes.
Like, if you want to get a good picture of the lateral,
Mhm.
I know Mr. Dunn, you were telling us you don't want to use a lot of sheet, to get the lift. If you're on this side doing the lateral, do you use the
so you do not,
He was talking about whenever we do the sheet.
the sheets? Yeah.
Because a lot of the x-rays that we
Yes.
were seeing had a lot of like of the sheet in it. And so he was like, just be careful whenever you're using the sheet.
right, so one thing that they do say you can do, if you look at his spine is kind of U-shaped right now.
Mhm.
So to straighten out the spine, straighten out the abdomen, you put sheets right down here to kind of build this
Oh,
part
okay.
up. But if you do that, then the sheets show up in the x-ray
Yeah.
and then you have issues. So do try and find something that is radiolucent. Radiolucent means it lets x-rays through, doesn't show up on the x-ray.
So is that when you would use like a wedge or
Yeah.
sponge or something?
Right, you would use a radiolucent wedge or something if you have that available. If not, I mean, sometimes you can just leave them like this if the
Okay.
curve isn't that bad.
Okay.
Okay. Notice, right, we doubled up the pillow, make his head more comfortable. Earlier he was like breaking his neck. Don't break his neck. Okay, in addition, arms, bring them up like this. Doesn't need to be that high, just in front of your face. Yep. There you go.
Oh, okay.
Just
so
get the
this is out of
elbows,
the way.
right, just to get the arms out of the way, elbows and arms out of the way. All right, so now we have access to this nice straight back. Where do we center?
2 inches
2 inches
above.
above.
No, it's still vertical.
That's right, the tube
Oh,
is
it's-
vertical.
Oh, so you just float the table, huh?
Aim it right here at the crest.
The crest.
Now, we were at the crest earlier.
Mm.
He turned, but he did a lot of movement, so we always want to double check
Okay.
our crests. And yeah, the crest is all the way up here now.
So you just need to move him.
Take-
Okay.
So I'm going to hide the crest. Next, I'm gonna check my MCP. Okay, so make sure our patient is straight first, and then MCP in the middle. Maybe back just a tiny bit.
So can we do our W trick also with these laterals?
Oh, you mean,
Mm-hmm. Since
you
it-
can try. It's gonna be a bit tougher.
Just make sure that the lights even on both sides?
Yeah.
Mm-hmm.
Okay.
Right. So, I mean, you know that MCP now is like coming down from this
Side.
axilla here, like in
Mhm.
front of the armpit. So yeah, as long as that is there, then you're pretty good. And then you should have light, either light on both sides or kind of shadowy on both sides. Also with abdomens, just because you have shadow on the side does not mean you're actually missing anatomy. It's kind of tricky that way because when the beam spreads, it will actually show everything,
Oh,
even if you have some shadow. Okay, so we're centered at our iliac crest. We are centered at MCP. Okay. Do we need a shield?
yeah.
Okay, can't shield on abdomens. So, what's left? Well, we have our positioning, right? True lateral, arms are up, legs are bent. So really, we just have marker collimation and breathing. Okay, which marker am I gonna use?
You wanna
I think you're going.
left?
Okay, why left?
To the
This
closer
left
to
is
it?
touching.
Yes, left is closest to the IR. Good.
Mm.
Where do I put this left marker?
Under his hip.
Under his hip, oh, you
Or
got some
behind
light
his
right
hip?
there. You guys got some light,
Put it here?
yeah.
No, the hip.
No?
Mm-hmm.
So on laterals, does the marker go interior or posterior?
I
Oh,
think
oh.
it goes anterior.
Marker should go interior on the lateral. So I'm on the wrong side. I'm gonna walk around, and I'll put my marker somewhere in the front.
Okay.
Alright, let's reach around. Let's see if we can find that. There we go. Okay, so we've got light in the front. Since we have light, you could just put it here.
Oh.
No worries.
If
But-
we didn't have light?
But yeah, let's say that his abdomen covered everything here. Then yes, squeeze it somewhere down here by the hips. Right? This is leg, this is not abdomen, so I'm safe.
So, the vertical and the prone that we just did, and then also the supine,
Mhm.
those are all looking at lower abdomen,
Correct. Supine, prone, and lateral.
or lower abdomen.
Lower abdomen.
Whenever we did upright, that's upper abdomen.
Upright is upper abdomen. yes.
Upper abdomen, so you can obscure some, like, or not obscure, but you can mark kind of corresponding. So like when we were upper, we did that
Mhm.
upper quadrant
Mhm.
because it wasn't the,
You can think of it that way.
okay. I just wanted to make sure.
Now, to be fair, on your supine, you do usually want to get both upper and lower.
Okay.
So if your centering on the supine does not give you a picture that includes both pubic symphysis and diaphragm, if it only gives you pubic symphysis,
That's cool.
you still do an upper one supine in clinic.
Okay,
Right, so when
so you
you're
have to do two.
correct,
images.
in the real world, you usually end up doing 2 abdomen x-rays for your
You get
patients.
an upper and a lower.
Correct, upper and lower.
Yeah.
So if you are doing an upper supine, you have to do 2 inches above iliac.
2 inches
crest.
above iliac.
Do I need, oh no, the beam is still vertical.
Mhm.
Yeah, okay. So 2 inches above for any uprights, or any upper abdomen.
In the upper abdomen, yes. Okay. Need help getting up? You okay?
I want to sleep.
Good, good, good. All right.
Sounds like
You got it, don't do it.
Okay, one more note about those upper abdomens. In clinic, right, in the real world, what you'll find is techs are gonna say, okay, if you do lower abdomen first, lengthwise. If you don't see the diaphragm, do the upper one, but do it crosswise.
Oh,
Okay. If you do end up doing it crosswise, you are no longer gonna center 2 inches above the iliac crest.
Are
Because
you
your
gonna do
cassette
like
is
a PA?
not as long.
Or an AP chest?
What is that?
Would you do that like an AP chest then? Because that was a series.
Similar.
Okay.
So, basically, patient's laying down. Just imagine I'm laying down. Okay, you do a lower abdomen. You get pubic symphysis, but you're missing the diaphragm. So, normally I'll just tell you go 2 inches up and get the diaphragm. But in the real world, in clinic, a lot of the texts will say go crosswise. This is shorter now. This doesn't reach as high. You might end up missing the diaphragm. So instead, you do what you do on your chest, just slightly different. On your AP chest, how do you find T7?
At the axillary.
It's right here.
At the axillary, right? You put the center at the axilla. In this case, you put the top at the axilla.
Oh, okay.
That way you know your top's at T7, and you're guaranteed to get
that
diaphragm.
done.
Yeah,
Do you
okay.
still keep it crosswise?
Keep it crosswise.
Just go up. Okay.
Crosswise, just go up.
Okay.
So, please don't do that during test out, but that's a
Oh.
nice trick for in the clinic.
Okay.
That's good. Okay, the final one is going to be the DQ, which means we need to start moving this into a decupitous position. Right. So, got this. Slide this over. Okay. And of course, since we're doing DQ, please don't forget, switch it over to tabletop.
Oh, you need that. That's why you said that's good.
Yes, I will need that. But I unfortunately will need the music.
That's fine. I'll use the stand
Man, I didn't even do it there. I thought it was right here. I've been dodging over here. The camera was like, and she told me it was over there. Like, oh my.
That's fine.
I'm like, oh man.
Okay, so, Tori, we're gonna have you as our final patient, I believe.
Yes. Man, I'm gonna run out of storage after these 2 minutes.
Waiting for next semester.
I know. That's why we already have the YouTube. So that we can just upload it to YouTube and delete it from the phone.
Great, so any mistakes I make during lab will now be forever.
Now, forever be on
On the
YouTube.
internet. Oh boy. Okay, so if you would, have a seat here, please. Lay down on your back, face up. On your back, face up, and here by the pillow. Very good. Great, patients on the table. First thing is to do what?
Raise the tape up, move the tape up, unlock the table, move the tape up.
Raise it up, good. Oh, you were learning. Okay, comfortable height for me now. So, next up, what do I do?
Do you set up for the, set your, the cassette?
So, right before I do
Oh,
that,
you gotta make sure she's straight.
that's right,
Yeah.
I'm gonna make sure she's straight. So, what do you think?
Relatively straight. Yeah, she's already in position.
She's in position?
Mhm.
You think so?
Mm-hmm.
What do you think, Juan? In position?
I think I see a little bit, at least, no,
Okay,
a little bit.
good. So to me, this is what's considered straight. I think she's a little bit.
Oh, yeah.
Like
Well,
this.
that way, yeah.
Right. So, for example, I could ask her, bring your shoulders towards me, please. Okay. How's that
Okay,
look?
well, that's better, yeah.
Better? Alright, great. I think actually we can bring the shoulders over just a tiny bit more. Tiny bit more. Yeah, perfect. Okay, great job. Okay, so now that our patient is straight, I'm going to bring the cassette over. In this case, if I do a decube like this, what kind of decubitus will it be?
This would be, dorsal.
Dorsodecubitus, very good. Patient's laying on your back. Okay. So, I'm just gonna ask you to bring your arms up, and I'm gonna put this board right next to you. Okay. So, I want you to kind of stand, once again, near the head and the foot of the table. Okay, right now, I have this, and I bring it straight in, right?
Okay.
And when I bring it straight in, it hits her hips down
Yes.
here. But what do you see here?
Space.
Space. So what if I want to get rid of the space?
Oh,
Now what happened?
oh, it's touching it.
It's touching. What happened to the cassette?
Oh, it's tilting.
It's tilted, it's
Yeah.
crooked, right?
Yeah.
So, do you prefer to have space or do you prefer to have a crooked cassette?
Well, that takes space.
Correct. It's okay to have a little bit of space. More important is to keep your cassette straight. Okay, so don't force your cassette up against the patient,
Okay.
right? Or else you may make it crooked.
Okay.
Now, some patients, you'll be able to get it perfectly flush against them and have no problems, right? I think, who was it? Was it Ryan on Tuesday? It might have been Ryan. We did this and it was perfectly against the side,
Oh, okay.
wherever it was. So yeah, just depends on your patient. Some
Yes.
people have that hourglass figure where it's like wide, thin, wide. And if that happens, you end up with space.
Okay.
Right? Some people are just like straight cylinder.
Yes.
And if that happens, you have no space.
Okay.
Don't let that throw you off. Just keep your cassette straight. Okay, now I'm gonna start doing my centering. So, first things first, I am gonna be trying to center to the iliac crest, correct?
Yes.
No,
SID.
2 inches above.
2 inches above.
Because
Inches
we're
above.
horizontal.
Yes, I'm sorry, I tricked you.
Yeah,
I apologize. So, yes, because we are horizontal beam, I'm gonna check the crest and go 2 inches above. I'm gonna check your hip bone, okay? So if I want to, I could come up to the front, find it as is, follow it around, or I can just feel the side and go straight for the iliac crest. Either way, we'll find that it is right here. Okay, so I'm gonna do my 3 fingers. Right, so iliac crest. Right, so might be hard to see, but iliac crest, right?
Yeah.
2 inches up. So this is where I actually want to center. Okay. Since I moved my tube, I'm gonna make sure to move my cassette to match. Right, so lined up. Okay. If you don't have a stand, the patient could actually help you just hold the cassette. Mhm. Also, because we are doing D-cube, normally we would build the patient up, but in this case, I don't have many sheets, so
Okay.
just pretend that we
Yeah,
built
we
the
built it
patient
up,
up.
okay.
Okay, while we're here, we might as well do SID. So I'm gonna drag this across, bring this a bit higher so I don't hit anything accidentally. I'm gonna bring this across, and what is my SID?
64.
64. What should it be?
40.
40, correct. So, all right, that's 40, right?
No.
No.
What is it?
58.
58. That's 40, right?
No.
What is it?
53.
53. All right, that's gotta be 40 now, right?
46. 43. 40 now.
Now it's 40, okay. Ooh, good catch. All right,
Okay, I got it.
so look at how close the tube is to the
That's
cassette.
close.
Look at how close it is to the table.
Yeah.
Right, if I bring this down, I can
Can even
barely
walk.
a hand away.
Yeah.
So be very, very careful with your tube when doing these, because you are very close to the table. You don't want to crash the tube into the table. If you get scared of having the tube this close, is there anything you can do that would allow the tube to come back further?
No.
You could scoot the patient closer to the edge of the table.
Oh, okay, so just move the patient over.
If the
Okay.
patient comes, so
Okay.
keep the table where it is. But if the
Move
patient
the
comes
patient.
over, cassette comes over,
Okay.
tube gets to go back.
Oh, okay.
But then you also don't want the patient to roll off
Yeah.
the table, so it's a balance, right? You have to strike a balance.
Yeah.
Alright, so let's take a look here. Alright, we're
Just-
still
I need to
centered.
move this a little.
That's okay. Alright, go ahead and just raise this arm then. So we're centered to 2 inches above the iliac crest. We're at a 40-inch SID. I'm now going to go for my MCP. Okay. going mid-coronal. Here I do have a lot of flight above the patient, so I can afford to collimate. Right? I can collimate it a little bit. Okay. I can probably raise it up just a tiny bit. There we go. All right. Fortunately, we can't really show a patient here. So we go to markers and breathing. Which marker am I going to use?
Left,
Why left?
because it's on the left side.
Good, left side's closest to the IR. Okay, where am I going to put this left marker?
At the top of the light.
Okay, great. So if you hit the light, you notice I do have room up here to squeeze my marker. So if I wanted to, I could put the marker in the light. Oops, sorry. Pardon me. Okay. Now, if you had to prefer a side, top or bottom, which side do you think I would prefer?
For the top.
Top, right?
Mhm.
Just like with our upright.
Mhm.
Keep it up here by the chest.
Yeah.
So just in case it does overlap anatomy, it shouldn't be anything important. Okay. And then breathing instructions. So, Thaddeus, if you would please.
All right, I'm gonna have to take a deep breath. Breathe out. Hold it. X-ray. Relax.
Very good. Okay, and so this is our left dorso-decubitus. Right, left side touching, patient's on their back. So left dorso, horizontal beam, decubitus. Great. Next, we are going to do the lateral decubitus. Now, just like with the chest, you can do left or right lateral decubitus. But which one is preferred?
With the left,
The left lateral decubitus is preferred. Why?
So that
because
your stomach doesn't get in the way of anything.
Your stomach doesn't get in the way of anything, so you want your liver to get in the way instead.
No, because oh my goodness.
You're on the right track.
It's something along the lines of the liver. The liver shortens something,
So what is inside the stomach?
or the stomach does.
What is inside the
a
stomach?
fluid,
Fluid and
air.
air, right? You've got gastric
Oh, I
fluid.
forgot that the air
Yeah.
comes up and the liver, on the left side, the air rises and fluids drop.
Right, air rises, fluids drop. So if the stomach's on the top, the air from the stomach is gonna rise to the
Rise
top.
to the top.
If you have free air, it's also gonna rise to the top, and they're on top of each other. And you can't tell them apart because air is air.
Oh, yeah, that's right.
You do it the other way, and the liver's on top. Does liver have air?
Nope.
It does not, it's just solid tissue.
Mhm.
So you've got this massive tissue, you see this air rise up, a black band, that tells you you have free air.
Yeah.
Okay.
So the air in the stomach is what gets in the way,
Okay.
specifically.
Okay.
Okay?
And the air in the stomach is just like not like gas, like it's just normal.
It's normal.
So it's okay. You just want it out of the way.
Correct.
Okay.
Okay.
Even if your stomach's empty, you're gonna have gas inside your stomach.
Okay.
Your stomach's not gonna collapse on itself.
Okay.
Okay. So if I turn my patient towards the tube right now, is that a left lateral decubitus?
That's right.
That's a right lateral decubitus. So what do I need to do?
The cassette on the side, and you slide the
All right.
table.
Swing your legs over this
Yeah,
way,
just-
please.
You see, I mean,
Sit
go
up
to
and
this,
swing your
go
legs
that
over this way,
side.
please.
But here you go now, here we are.
Go ahead and sit up. Legs over the table. There you go. Good. Relax for just a bit. I'm gonna scoot this out from under you.
Oh, I didn't mean to jump down. I'm so sorry.
You're good.
I just jumped.
You're good. You're just being a normal patient. It's okay. All right, and then head back down. There we go. And then turn around. Careful, you're near the edge. So scoot towards me first. Good. And now turn. Turn to face the sink.
Okay.
Okay, good. Now bring your toes down. Okay. And then let's get into a nice lateral position. So keep turning your shoulders. Good. Great. Patient's left side is down, correct?
Yes.
Left lateral decubitus. AP. First thing we do,
Oh, bring the,
not yet.
The J base.
forgot the cassette.
All right, so
Oh, you got a lot of
is
that.
our patient straight?
I don't feel like I am.
Nah, I think you gotta Bring the top part back this way.
Good, we can bring the shoulders back or we can
Bring the
bring the hips
shoulders back.
forward. Now, don't move yet.
Okay.
So here's a nice little trick that you can use with these, right? You've got the board, right? The board will also
This
tell
trick,
you
yeah.
if the patient's straight. So bring those hips forward. Scoot forward.
Oh,
Yep, keep going. All right, good.
oh, you got it straight.
All right, got it straight, right?
Mm-hmm.
Pretty good. Great. So that's out of the way. Now we can start doing everything else. Okay. So just like on a chest D cube, right? Arms up, pillow between the legs if you have it. Okay. Here we don't actually need to take the pillow out from the head because abdomen's low enough that the arms don't have to go that far up.
Yeah, so it just go up, and you know, they say they don't have to go all the way over here, just out the way.
Right, it can just go up a little bit.
Okay.
But if the patient's able to do it this high, then that means I am able to take away the pillow
Okay.
and put it between the legs. There we go, perfect. Right, make sure that the shoulders are straight, hands forward. Yeah, you see how we have this big gap here? Okay, so let's see if we can fix that first. Right. Let's see, bring your hips forward a tiny bit more. There you go. Good. All right, centering point.
2 inches.
2 inches above the iliac crest.
2 inches above the iliac crest. I'm gonna check for your hip bone. Okay, the iliac crest is right here. 3 fingers, so this is 2 inches above the iliac crest. All right, I'm gonna open up my collimation just so that I have an easier time seeing what's going on here. So, line this
Slide it
up.
open.
Here we go. Okay, let's just double check my SID. Alright, 48. So let's just bring this in. Keep an eye on my table as well.
That's perfect.
Good. Alright, and then bring this in to my MSP. So these are lying here in between the legs, coming up here as well. You'll notice that if I collimate this way, right, I should have my light going away at the same time on both sides. Okay, so no light at the top and no light at the bottom. Okay. Make sure I don't have light on the edge of my cassette here either. Okay, I want to be inside my cassette.
Okay.
Okay. And then markers. Which marker am I going to use?
The right,
The right.
Why the right?
You don't.
because the right's touching the
Oh.
or
No.
the,
It's the left. You use the left, and the left is down.
but where would you put it?
At on the top of right.
On the
Right.
So we put the right marker.
Right, yeah.
right.
This is because the right side is up.
Yeah, okay, I thought you kept saying left. Did
Yeah,
you
he
say
asked you
left?
right. You said right or left, so I was like
Okay,
thinking out that she's on the right now. The right is up now.
Good. So we've got a right marker here. Perfect. It's in the light.
Yes.
And finally, we need to do our breathing instructions. So, Tuan, if you would give us the breathing instructions.
Yeah. Breathe in, breathe out, and hold it, exhale, and relax.
Good. All right, good. Just try and give them a bit more time to finish breathing out. Right? So, deep breath in, blow it all the way out, wait for it, like watch as their chest sinks, right, as they breathe out, and then tell them stop breathing and exhale. Good. And that is our D cubes. Just like the chest, just centered a bit lower, not too bad. Any questions? All right, in that case, we move this out of the way. Get the pillow and the cassette out of the way as well. I'm gonna start this out. I'm gonna take this out as well, thank you. All right, just throw this here for now. Okay, please don't jump off the bed yet.
No, I won't.
Let me lower this first. But that's exactly what patients do, so don't worry about it. Good, I'm gonna lock this. Do you need help getting up?
No, I'm okay.
young bones, so they can just get right on up, man.
Yeah, so in addition, when patients do sit up, sometimes they can get a little bit woozy, especially if they've been laying down for a while. So just give them some time to get ready before they stand up. You don't need to rush them.
Get up. We got
Yeah.
Got 3 more patients waiting. Don't do that. Okay, and it's exactly 8:30, so
Yeah, come on, fast.
just some final things before we go. Next week is going to be practice. One of the #1 things that students need to practice for the section is finding the iliac crest. So, classmates, friends, family, anyone you can get your hands on, right? As long as you don't batter them, try and find the iliac crest, right? The more body types you can practice on, the better, because you'll learn that some crests are really easy to find, some are really hard to find. Some you can follow from the as-is, some you can't. So just get that experience so you can have an easier time finding it when the time comes.
And so the as-is is in the front, and then you said you follow it up.
Correct. As is in the front, just follow it all the way up. All right. Well, have a wonderful rest of your day.
Oh, yeah.
And I'll see you tomorrow.